Imagine waking up to the news that a mosquito-borne illness is spreading rapidly in a major region of China. This isn't a scene from a movie. It's the reality of the Chikungunya virus outbreak in Guangdong Province. The U.S. Centers for Disease Control and Prevention, CDC, has issued a travel warning, urging caution for those planning to visit the area. As of June 2025, over 7,000 confirmed cases have been reported, making this a significant public health concern. But here's where it gets controversial. While the CDC emphasizes the importance of vaccination, some experts argue that the focus should also be on addressing the root causes of such outbreaks, such as climate change and environmental factors. The outbreak in Guangdong Province has been exacerbated by monsoon flooding, which has created ideal breeding conditions for mosquitoes. These mosquitoes are the primary vectors for the chikungunya virus, spreading it rapidly through the population. The CDC's travel warning highlights the importance of taking precautions, especially for travelers who may be at higher risk. Dr. Todd Ellerin, Chief of Infectious Disease at South Shore Health in Massachusetts, advises travelers to the region to take every precaution possible. Wear long sleeves and pants, use insect repellent with DEET, and use mosquito netting for babies too young for repellent, he recommends. These measures are crucial in preventing the spread of the virus and protecting oneself from infection. So what exactly is chikungunya? Chikungunya is not a new infection. It has been around since the 1950s, with outbreaks more commonly seen in tropical areas in recent decades. Globally, there have been about 240,000 infections since the start of 2025, according to the European Center for Disease Prevention and Control. In the United States, however, chikungunya is not common. The CDC reports that there have not been any locally acquired cases since 2019. The symptoms of chikungunya can be quite debilitating. Common symptoms include sudden onset high fever, severe joint pain, especially in the hands, wrists, ankles, and feet, muscle pain, headache, fatigue, and skin rash. Most people recover without medical intervention within 7 to 10 days. But in some cases, symptoms can persist for weeks or months. And this is the part most people miss. While the symptoms are often manageable, the long-term effects on joint health can be significant, affecting quality of life for some individuals. The incubation period for chikungunya is typically less than 1 week. If it's been more than a week since you left a high-risk area, you're likely in the clear, according to Dr. Ellerin. This means that if you develop symptoms within this time frame, it's important to seek medical attention promptly. There is no specific antiviral treatment for chikungunya. Instead, care focuses on relieving symptoms while the body recovers. The CDC recommends rest, fluids, and medications like acetaminophen for pain and fever. NSAIDs may be used once dengue, another mosquito-borne disease, has been ruled out. Deaths from chikungunya are rare, but the illness can be quite uncomfortable and disruptive to daily life. Is there a vaccine for chikungunya? Yes, there are 2 vaccines available in the U.S. that begin offering protection within about 2 weeks of a single dose. The CDC recommends vaccination for travelers visiting areas with active outbreaks, people spending extended time abroad, typically 6 months or longer, and laboratory workers who handle the virus. But here's a thought-provoking question. Should vaccination be mandatory for travelers to high-risk areas, or is it enough to rely on individual responsibility? Climate change is a major driver of chikungunya's global spread. Warmer temperatures and increased rainfall are helping Aedes mosquitoes expand into new regions, says Dr. Kritika Kopali of the Division of Infectious Diseases at the University of Texas Southwestern. Share your opinions in the comments below.